Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Wednesday, April the 8th, 2020. My name is John Bradford. I'm a small business owner right here in North Mecklenburg. I'm also a former member of the North Carolina House of Representatives, and I am your briefing call moderator. The purpose of this call is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to help update, educate, and support the North Mecklenburg region during the outbreak. We are in day 23 of the President's 30 days to slow the spread. If you feel sick, please stay at home. If someone in your household has tested positive, please keep the entire household at home. Do not go anywhere. And if you're an older person, please stay at home and away from other people. As you can see, there's again an iceberg. I leave this picture of the iceberg because there could be a larger brunt of this coming. So we got to continue to be smart. I think we're doing a great job, and we don't want to let our foot off the gas right now on how we're being very careful. So let's continue to do that. President Trump announced social distancing is required through April 30th, and this graphic on your screen just shows how one person not infecting two people, the difference it really makes. And the graphic, I think, says everything. The CDC does have a recommendation regarding the use of cloth face coverings. These are not the surgical N95 masks. Those are reserved for our frontline personnel. But there's a new thing on the CDC about how to properly wear a face covering. They should fit snugly but comfortably against the side of the face and be secured with ties or ear loops. They should include multiple layers of fabric, and they should allow for breathing without restriction, and they should be able to be laundered and machine dried without damage. So that's the proper way, and you can see the graphic showing you how to do that. Again, if you need any cloth face coverings, we do have a company in North Carolina in Dara Mills that has started making them. I know the price changed slightly. They're $2 per face covering. You can order 12 dozen minimums. It's a 3-ply cotton face covering with elastic for your ears, and they are machine washable. And the phone number is right here on your screen, 1-800-334-8605, and you'll go to customer service option 1, and someone will answer the phone and take your order with a credit card. So if you need some, I'd encourage you to take advantage of these. Just a friendly reminder, Apple and the CDC have put out a screening tool. You can screen yourself, or you can use it to screen someone else with symptoms. This is a way to reduce people from, calling their doctors first, although you should always call your doctor if you think you need to, but this is just a screening tool developed by Apple and the CDC. So just a friendly reminder, this is out there. As of yesterday, April 7th, the total number of cases in the U.S. is 374,329 with 12,000 deaths. Of course, that number's already changed because today's the 8th of April, but it just shows every time this number continues to increase. FEMA has a rumor control website. There's a new rumor. This one was interesting to me. Is 5G cell phone technology linked to the cause of coronavirus? A worldwide online conspiracy theory has attempted to link 5G cell phone technology as being one of the causes of the coronavirus. Many cell towers have been set on fire as a result. 5G technology does not cause coronavirus. I have not heard this rumor, but it's on the FEMA website, and I always like to share with you new rumors so you can see those right here. And do not be scammed. If someone is telling you they can send you money or ask you for personal information, please do not fall for that because you're being scammed. North Carolina is still under a state of emergency. As you can see, here are some helpful numbers. The death count in North Carolina as of 11 a.m. this morning is 53. We have 3,426 cases, and that's up from Monday's call. We had 33 deaths, and we're now at 53 deaths. So you can see the number is continuing to climb right here in North Carolina, and we now have 90 out of 100 counties impacted. So there are only 10 counties left that do not have a reported case, although they probably do. It just hasn't hit the radar yet. So 90 out of 100. And age statistics, if you are curious, death rate by age, 79% are 65 and older. And the number of folks that have been confirmed with this, believe it or not, ages 25 to 49, 41%. So this thing is getting everybody, although the death age is definitely higher at the 65 and up category. The North Carolina governor, there's no new executive orders, but we're still under a statewide stay-at-home order. So just, that's going through April 29th. There's a good chance that could get extended. We shall see. I'll report so if we do. We need healthcare volunteers. If you want to volunteer, there's a website right here. You can go and volunteer, whether you're clinical support, and if you have any medical supplies as well. Mecklenburg County data, and Commissioner Cotham will probably give the latest numbers, but on the website, 805 positive cases and 8 deaths. And this was as of earlier this morning on the website, but Pat always has updated numbers, so I look forward to hearing those. Mecklenburg County commissioners announced Tuesday, that was yesterday, that all the gates to Mecklenburg County parks will be closing. So I live near a park, and I saw the gate was closed this morning. Walk-in traffic is the only way to access a park. So no more vehicles, and so walk-in traffic, and I don't know if that includes bicycles. I'll let maybe Commissioner Cotham will clear that up for us when we get there. And then solid waste management is asking residents, do not put yard waste in recycling containers. So no yard waste, please. And the reason why is they want to ensure workers can maintain social distancing, and let's not have them do a bunch of extra work. No yard refuse. You know, you can do your standard recycled products, but please right now do not put any yard waste in those. And you can go to mecnc.gov for updates. And the new heat map, this is still a couple days old, but clearly North Mecklenburg, 13 to 25 cases in both Cornelius and Huntersville, and 0 to 12 cases in Davidson. And in terms of same thing with age here in Mecklenburg County, 60 and up, hospitalization rates are pretty high. But I did find this interesting. 75% have never been hospitalized, and only 19% have been hospitalized. So the reality is you can still handle this while at home, which is good. Now, let's go on to Congressman Greg Murphy. I don't know if he's able to join today. Congressman, are you with us today?
I am, Brad, or John.
That's okay. You can call me. I've been called far worse things. Glad you're on the call, and love to hear an update from you, my friend.
Yes, thank you, John, again for doing these. These are very informative, and I think it really helps the folks understand and educate about what's going on. I'm going to go back to a couple points, just 2 points. One, the small business loans, now in their really 4th day, if you include the weekend, over close to 40,000 loans have been processed. There's a lot of frustration. And guys, this was started, this process was made in a week, and there's going to be a lot of backlogs, but I would just urge persistence, and I would urge patience. We're going to probably be going back to Washington D.C. to add money to the small business loans, which I think will be needed because they've been very, very popular. Let me go back a little bit. This is my personal opinion. I'm just giving some reflections here as a physician and as someone that studied this disease process very closely. You know, I pushed the governor. I really, really pushed us to do a statewide stay-in-place order. I think that was the right thing to do. I think it's continuing to be the right thing to do. However, I had heard rumors that there was going to be another statewide issue, everyone stay in place in May, and actually have had discussions with state, local, and national officials about this. I think it's going to be time. You know, the whole purpose of flattening this curve was to allow resources in hospitals not to be overrun. And that was the whole purpose. The virus is not going to go away. I think by flattening the curve, we've also saved lives. But at some point, we have to look at the detrimental effects of what our interventions have been. What have they done to mental health? What have they done to physical health? Because, you know, I, as a physician, see patients with cancer a lot of time. We're not seeing those people. Our emergency room, people are not going to that, a lot of whom didn't need to go anyway. But a lot of people have put off well checks that they should have. People with bad diabetes, congestive heart failure, kidney failure. And so are we creating more of a problem now than what COVID is causing? I'm not saying I have an answer to that, but I think that's a robust discussion that we need to have. And how do we address it? How do we start taking our foot off the brake? I would submit this, that maybe at the end of this month, we have considerations that individuals, just to your point, individuals over the age 65, again, shelter in place. Individuals under 65 who have severe diseases like diabetes, kidney failure, being treated for cancer, cystic fibrosis, those people continue to stay in place until we get point of care testing and we can see where the disease is out in the community. I think we'll have that hopefully by May. But otherwise, individuals under age 65, I think we need to start being able to relax things a little bit. Everybody should wear a mask, to your point, they should be wearing a mask. But maybe barbershops should open up or stylist shops or have every other chair available. Restaurants may be coming back at 25% capacity. I think we need to start having that conversation because while we are losing lives, are we also creating a bigger problem in doing this? I don't have the right answers, but I think that discussion needs to start occurring. So God bless, John. Thank you all for doing this. It's very informative and allowing me to be part of it.
Yeah, thank you, Congressman Murphy. Thanks for keeping our country in good shape as well as our state. We appreciate you, sir. Now we're going to go to the United States Small Business Administration. We have our North Carolina Director, Mr. Thomas Stith III, who's with us today. Mr. Stith, the microphone's yours, sir.
Thank you so much, John. I appreciate the opportunity to address you today. I do want to give an update since our last call, and Congressman Murphy just alluded to an initiative that was launched not quite a week ago, and that's the Paycheck Protection Program. I've talked earlier about the economic injury disaster loan, and that is still available for small businesses throughout North Carolina. Those loans go up to $2 million, 30-year term, 3.75% for businesses, 2.75% for nonprofits, and that does include nonprofits, our faith-based organizations. We have clarity on that now. In addition to the benefit of the economic injury disaster loan, there is also an emergency advance that can be requested, and the applicant can receive up to $10,000 that is really in the form of a grant. These funds, if approved, would not be required to be repaid, regardless of whether the full economic injury disaster loan is approved or not. So this is a way SBA is providing immediate economic relief to our small businesses if they qualify for the emergency advance. So the economic injury disaster loan is still available, still encourage listeners to pursue those if they feel that's appropriate for their business. But in addition to that, we now have the Paycheck Protection Program. And this is designed to keep not only businesses operational and to help sustain them through this just critical pandemic we're going through, but as importantly, to keep people employed, to keep North Carolinians employed. So the Paycheck Protection Program is a grant, and this is through your local lender. The economic injury disaster loan is applied through SBA, but the PPP, as it is called, Paycheck Protection Program, we are utilizing local lenders as the point of contact. These loans will be guaranteed 100% by SBA, but by broadening the base and having lenders involved, we feel we can reach more small businesses. The incentive for small businesses within this loan is that there is a forgivable clause. If proceeds are utilized for payroll, and that is the incentive to keep people employed or to bring them back on and have people working, utilities, lease payments, mortgage payments, the portion that is expended from the proceeds of the loan during the first 8 weeks of distribution after the loan is distributed to the small business, that amount is forgiven, so that the small business would not have to repay the amount that is dedicated toward paying their payroll and utilities and mortgage expense. And again, as it was alluded to earlier, it's a finite amount of funding now, $349 billion. So the objective is that at least 75% of the proceeds if the business wants it to be forgivable, at least 75% would be dedicated toward payroll, and then the other 25% could be dedicated toward the allowable expense of utilities or rent or lease payments. So this initiative was just started on this past Friday. There are existing SBA lenders in the state that are pursuing this, and so we are encouraging small businesses to talk to their initial or their current lenders first. If not, there are other lenders, both banks and credit unions, that are available, and we feel this is another economic infusion that will be helpful to small businesses. As we know, North Carolina has over 900,000 small businesses employing 1.7 million North Carolinians. So we feel the PPP, or the Payroll Protection Program, will be a key source to sustain employment with our small business community. So we'll continue to keep you updated, and just very, very pleased that now we have this additional tool to help sustain small business in North Carolina. Thank you.
Yeah, thank you, Mr. Stith. And I can tell you, I am very connected to a lot of small business owners, and I know many have applied for the PPP, myself included, because I have two businesses, and and everyone seems to be impatient. And I think this is a fabulous program, and we thank you for your leadership. North Carolina cannot do it without you, so thank you. So now we're moving on to, I invited Chris Pittman as a policy advisor to the North Carolina Speaker of the House, the office of the Speaker, I should say, and one of his specialties is unemployment. And so obviously with unemployment happening right here in North Carolina, I thought it was wise to have a resource on. And so we have Chris with us today. Mr. Pittman, are you on, sir?
I'm here.
Very good. The microphone's yours, and I do have a slide up that shows some of the phone numbers and information for the Department of Commerce.
Excellent, excellent. As you said, my name is Chris Pittman, and I work for House Speaker Tim Moore here at the North Carolina Legislature. I'm happy to be with you all today and to be able to provide some information and updates on unemployment benefits here in North Carolina. I'm going to try to provide a lot of information in the next few minutes, so please bear with me. And if you have any questions or would like more information, please reach out to me via email at chris.pittman, Pittman, @ncleg.net. First, I want to give a little detail on the current situation here in our state. At the height of the Great Recession, North Carolina Unemployment Office was handling about 100,000 unemployment claims a month. Yesterday, the NC House Select Committee on COVID-19 was told by Employment Security Secretary Lockhart Taylor that since March 16th, more than 450,000 claims have been filed. Basically, this means the department's averaging about 21,000 claims a day, or roughly 1,000 an hour. As you can imagine, this volume has put significant strain on our system, and last Monday alone, the Division of Employment Security received 250,000 calls. I know a lot of folks are frustrated, and our office has been in constant communication with the Division of Employment Security. We are told that they are aware of the issues people are having and that they are working as fast as possible to meet this unprecedented demand. Over the past few weeks, the division has been increasing their computer server capacity to help ensure the computer systems can handle this volume of people filing online, and the division has added more than 200 staff to assist with processing claims and provide support. The division has assured us that claimants will not miss out on any weeks of eligibility due to the high call volume and tech issues, and they will make sure once processed that claims are paid from the week when people initially attempted to file. So far, the division has been able to approve roughly $30 million worth of unemployment benefits for people who lost their job due to coronavirus. If you have applied for unemployment and were denied state benefits, you may qualify for one of the new federal programs contained in the CARES Act. The Division of Employment Security received guidance from the U.S. Department of Labor on Sunday evening for these programs and is working to implement and get those up and running here as soon as possible. Rest assured, if you are owed any benefits for a week previously claimed, the department has said payment will be made retroactively. I know many people have questions on if they may qualify for one of these new programs, so I have shared an eligibility flowchart that will be shared with you and help give some detail to those programs. For those who are needing to file a claim, please visit des.nc.gov to create an account and file a claim. Or if you do not have access to a computer or need assistance, please call 888-737-0359. In order to file a claim, you will need a few items, and those are going to be your social security number, information about your most recent employment and pay, your work history over the last 2 years, and your bank account information for direct deposit. I think it's also important to note that if you are filing for unemployment benefits due to COVID-19, please select coronavirus as your reason for separation. Our office is hearing a lot from constituents on unemployment, and there seems to be a few common issues and questions that we're getting most often from people. So I wanted to share a few of those tips and answers with you. I would say probably the most common issue we're hearing is that folks are unable to get through on the phone lines and have been having problems logging into the website to create an account or check the status of their claim. Anecdotally, here in the last few days, we're starting to hear that folks are having better luck on the phones, and we're hearing that people are having success logging into the computer system to check benefits and create an account, mostly during off-peak hours. It seems that early in the morning and late at evening have been the magic hours for many people to access the website. And if you are having issues with your password or PIN logging in, please make sure to email ncdes passwordhelp@commerce.com. Probably the next most common question we're getting is about the length of time it takes from someone initially filing a claim until they receive payment. And right now that's about 14 days from the time the person files the initial claim. And probably the other question that we're hearing the most often is, do people who are filing for unemployment benefits due to COVID-19 need to complete a weekly certification every week to receive the benefits? And the short answer is yes. The weekly certification is basically a series of yes or no questions that help determine your eligibility for benefits each week. And if you do not complete one, you're not going to be considered for payment that week. So to complete that weekly certification, you're going to need to sign into your online account or to call 888-372-3453. And if you are filing due to COVID-19, it's important to note that the answer should be yes to the question on the weekly certification that asks, did you look for work? Hopefully we'll have some more information on those new programs as they're implemented, and we'll be happy to come back and share that. But I hope this other information has been helpful. As I said before, please do not hesitate to reach out if you guys have any other questions or if we can assist in any way, and happy to be here today and provide this information.
Thank you, Chris. Can you repeat your email one more time?
Yes, my email is Chris, C-H-R-I-S, Pittman, P-I-T-T-M-A-N, @ncleg.net.
Thank you, Chris, for that update. That was very helpful. And while you were speaking, like I said, I had the website up for people to see. So thank you for your leadership, and we appreciate you joining our call today. So now we are going to Dr. Jack Faircloth. He is a local doctor on the ground in Huntersville. And Dr. Faircloth, I know Monday you were covering for other doctors, so we're happy to have you back on the call. The microphone's yours.
Okay, thanks, John. I just want to say thank you to all the panelists and your leadership for creating this forum. It's going very well. I've got some great news to share. We are not out of the woods, but there are reductions in the plans for our field hospital in Mecklenburg County. Our testing has increased some, and so we have dropped the criteria for COVID testing down so that we can do more testing for less sick and less high-risk people. Our social distancing and stay-at-home order that Mecklenburg County put in place has started to show that the curve here in Mecklenburg is flattening slightly. So we believe if we stick to it, it will continue. And I just wanted to echo what the Congressman said, that we really need to be considering not just locally, but nationally, the impact of this virus in the non-medical ways, because the burden there is tremendous on our citizens. So let me begin by saying that the testing protocol has changed as of yesterday, and it's now just mainly three things for all of us who are outside of a hospital. The hospital has its own criteria, but outside of a hospital, the three things are: if you have an influenza-like illness, and that is the same temperature of 100.4 or feel a fever with a cough or shortness of breath, that's one criteria, you can be tested. Or if you just complain of acute loss of smell or taste, you can be tested. And last, if you are a suspected person and reside in a long-term care facility or homeless, of course, jails and prisons, we're offering a test at that to that characteristic. There are a few other hospitalized patient criteria, but for us, it's really just anything like a flu, loss of smell, long-term care residents, any of those three L's. If you want to test, the numbers have not changed for patients to call themselves to try to set up a test. Atrium's phone number is 704-468-8888. We had a patient yesterday call in the morning. Within an hour and a half, they had an appointment locally to get a COVID-19 test, and that was on their own without a doctor visit. And then Novant's number is 877-966-8268. Testing supplies have increased. Testing turnaround time, the best in Mecklenburg, is still 24 hours with Atrium and several days with the other healthcare systems and medical groups. I said that there was a field hospital size reduction, and that is because our most recent modeling over the last few days has been more positive than anticipated. So we no longer, Atrium Health and Novant Health are no longer planning to use UNCC for 3,000 bed field hospital. They are currently looking on their own campuses and sites closer to their hospitals where they could house a 600-bed field hospital. So that's great news. FEMA has, of course, said they won't support, can't support based on our numbers. So the healthcare systems are responsible, and they believe they can. As to finish, as you alluded to, we do have several cases. More, we have right at 805 cases in Mecklenburg County as of yesterday, and 8 deaths. Our state numbers, our death rate to state total numbers are still good in comparison. We are not a hot spot. For instance, South Carolina has 51 deaths out of 2,147 cases. We have 58 deaths in North Carolina out of 3,347. Georgia, unfortunately, is 9,100 with 348 deaths. So even in the South, we're not leading. The last thing I just want to say is we have to remember the impact of this virus has been devastating. There are physical tolls. We see numbers of death rates in the state of New York as of yesterday, for yesterday. One person in the state of New York died every 2 minutes. I just want to remind people that these numbers are not statistics. They are people. They're not just patients. They're moms, their dads, their brothers, sisters, friends, and in some cases adult children with living parents. And so we just really need to consider our neighbors, consider our community, reach out in ways that are safe to help and check on our neighbors, and keep other people in their prayers as well as their own families, because these numbers are staggering, but they're not numbers. They're people. I just want to say thank you for this time.
Thank you, Dr. Faircloth. Appreciate your leadership and being on the front line. And please thank all of your colleagues, because, again, we could not do this without them, and we mean that. So stay safe and healthy. Thank you. Going to Mecklenburg County, Commissioner Pat Cotham. Commissioner, the microphone's yours.
Oh, thank you. And again, thank you, John, for coordinating this, and for our other speakers. That was some great comments we have heard since the beginning of this call. We had our board meeting last night remotely. It went to, it was, I don't know, 10:30 or so. It was a little chaotic, as was our first time doing it, but we were able to get some things done. But it was a little frustrating where we weren't really able to discuss things as much as I think all of us wanted. But some of the highlights, we did talk about the parks, and that we learned that the decision had been made to reduce the parks by not allowing cars in there. So people can still access the parks on their bikes or by walking in, but we're trying to just reduce it. We've had a tremendous amount of complaints about it. And so that was the decision that we learned last night. We also talked about 2 different programs the county is doing. One of them was a smaller program, and the other one was a little bit more complicated. The first one was for micro businesses, and it does affect the North Meck towns, and it affects 2 of the southern towns, Pineville and Matthews, and then it affects the unincorporated area. So basically it does not affect the city of Charlotte. So it doesn't apply to people in the city of Charlotte or in the town of Mint Hill. And this program is for micro businesses that are struggling, and this is defining as fewer than 5 employees. And we have put out $500,000 to make available in loans up to $10,000, and it's on a first come first served basis, and the loan can be fully forgivable if the funds are used for payroll cost, interest on mortgages, rent, and utilities. And again, it's for businesses with 5 employees or less, just in that geography. Okay, now the second one had a lot of discussion, and it was more complicated, and it was a bigger amount of money. And just up front, I voted against it. I was the only one who voted against it. And I voted against it because I basically did not think that it was enough to help small businesses in the remainder of the county, in the whole county. And I also thought there were too many hurdles to jump. And since it was on a first come, first served basis, the people who are the most vulnerable, who probably don't live in North Mecklenburg, but in other parts of the county, would be left behind. And there was other commissioners who voiced concerns as well against it, but they ultimately voted for it, but I did not. And on this program, which is called the Small Business Emergency Stabilization Loan Fund, we will put out $5 million for lending, and the lending amounts will go from $5,000 to $35,000. But they are loans, and I struggled that we were going to pay a nonprofit $1 million to administer this, when the goal of this program, as I read in the documentation, was to accommodate, to do 142 loans. So 142 loans at the $35,000 for $1 million. I struggled with that, and especially in this time of great need of small businesses. $1 million could help 100 more businesses at 10,000, or 28 more businesses at 35,000. And now I did get the response that according to state law, we can't do any kind of forgivable loans. We can't loan money directly to people. I kept hearing all these things. And my premise is, this is an extreme moment in time. And I do believe that our leaders in Raleigh would listen to the biggest county if we came to them and said, we need an amendment to that law that says that during this time period, we want to do so-and-so. But there just wasn't the goal or the motivation to really go after a change from Raleigh. And I was like the only one. So I struggled with that. I think that we should have, I think our legislators and the leadership would have listened to us and at least maybe given us something. I think we should have tried, but that's not what happened. So again, the loans will be from $5,000 to $35,000, and they will be over a 10-year period. In the first year, the person can just pay the interest, which on $35,000 is $88 a month. And then after that, if they had $35,000, it would be $370 a month. I was very, and I made comments that I did not feel that the people who were at the lowest end of this group, I mean, I'm talking about whether it's a lady that has a baking, has a baking business, or a guy that has, a shed where he puts his lawnmowers, and maybe he rents his apartment, and he has a lawn mowing business. I don't think that guy can produce a 2-year P&L statement. So they wanted documents like that. And I from the people that I talked to, some of them didn't even know what a P&L statement was. These are, again, the people that are making the least amount of money, but they do have their own business. And I know from working with people in the past who had been in prison and had a hard time finding a job, many of them started little businesses, whether they were web designers or, a landscaping or car detailing business. I mean, it's all kinds of little things. So I feel that they would be left out. And I feel that the people who had the bigger businesses that would have, had no problem to pull out a P&L statement for the last 2 years, they would be the ones who would get this money. And to me, this wasn't good enough, and it wasn't enough money. And the 142 loans that they plan to do is not even 0.5% of the numbers, because right now we have like 30,000 of these small businesses. And I just didn't feel like we were really making a strong enough effort on this. And I thought we could have done better and we should have worked harder on this. So, but I was the lone dissenter, but I've been the lone dissenter on many things over the years. So that was probably the biggest topic of discussion. And we are going to continue to have our meetings remotely, even on the first and the third Tuesday will be our bigger meeting, as we call our general meeting. But then we have policy meetings on the second and the fourth Tuesday. So, and I don't have any updated information because it was so late last night. The county manager's going to have an update at 2 o'clock, and that will be on the government channel, so we can hear the updates for today. So that's my report, John. Thank you.
Thank you, Commissioner Cotham. We appreciate you. Now moving to Cornelius, Mayor Woody Washam. Mayor, the mic's yours.
Thank you so much, John. Happy to be part of this again today. Not much new to report today, but a couple items. We continue to be very concerned about the growth of the virus in our North Mecklenburg region, with the county at 805 now. The deaths climbing continually. We're concerned about it and trying to continue to hammer the rules of social distancing, encouraging folks to wear the mask and so forth. But we do look for ways. We had a board meeting, our first full board meeting this past Monday, virtual meeting as well. It was a big topic of conversations about how we can support local businesses. And one of the ways that we believe we could do that was relaxing the standards around our business signage and advertising as it relates to our small businesses from a retail standpoint, assuming they're still open. So we have relaxed those. We're going to give folks the opportunity to tell folks that they have the pickup service, and hopefully that will help them continue to promote themselves through the time ahead. We have also dealt with our some regulations related to our parks. I know I was on the phone with the town manager about 10 o'clock last night, discussing the county's action and questioning whether we should follow suit or not. Our decision is that we're going to continue evaluating pretty much on a day-to-day basis as to where we head with that particular matter. Our current position is unchanged, so our parks will be open. There was a conversation, I think, with all the town managers throughout the county about this topic, and I think they all agreed that at this time that would be appropriate. We find in that our compliance in the parks is good in our town parks. We are patrolling them more heavily and regularly, and the feedback we're getting from those that are patrolling is pretty positive. So if that changes, we'll be ready to act on a dime if we need to. So the other fun thing going on in our community, you got to have a little lightness through all of this, if you will. Our Cornelius Police Department and our Park Department have partnered together to spread some kindness this week. And what they're doing is they're taking the Easter Bunny around to Cornelius neighborhoods and waving at families. Police bunnies riding in the back of a police truck, an open police truck, waving and waving, and we're asking folks to step out on their front stoops, their front porches, and literally wave back. Kids are loving it. Social distancing is being certainly honored, and so it's just a little light in a lot of darkness out and about. Also having a lot of sharing with me related to some of the concerns in our neighborhood regarding folks that are in need of help and don't have a clue where to turn. So our town manager is looking into ways that we might provide proper referrals to folks. I've talked to a couple of our foundations in and around town, like the Peninsula Community Foundation, we're going to center our activity around the Cornelius Care Center, which is a faith-based care center on Smith Circle in Cornelius, and let our folks work with Manny there. I think the Peninsula Foundation has already stepped up with an amount of money. You've got to have these requests vetted a bit, as you can imagine. So they'll be doing that there, and hopefully being able to pump up these citizens that really have had issues for quite a while, but with this new event with coronavirus, it's taken them to a new lower level, so they're needing help. So we hope to, again, coordinate that through the Cornelius Care Center. If there are any desires for donation through that organization, they're listed, and if you can't find the resource, just let me know and I'll point you in the right direction. And that's all I have. Thank you, John.
Thank you very much, Mayor. Moving to Mayor John Aneralla for the town of Huntersville. Mayor, the mic's yours.
Well, thank you, John. And I want to leave you or start with two websites that I go to almost daily. One, charmecresponds.org, which gives you basically all the links that you need to get information, volunteer, links to the United States federal government or state government and local government. And then another one, if you're into the data and trying to figure out what is actually going on, not only here, but in the rest of the United States and world, healthdata.org basically is the data that people are making decisions on. So if you want to see why they're making those decisions, I would suggest you go to that. County closing driveway entrances to the parks. We have not made any decision to not allow you to go to the parks, but I can tell you that yesterday I did some biking throughout the greenways, and some of them are adjacent to certain parks, and there were a lot of, I would say, more teenagers that are congregating, and I feel like as a parent, that's my job to make sure that they're not out there hanging out with their buddies, and I will put that on parents to make sure that your kids are social distancing. A couple other things, talked to some hospital administrators yesterday, and at least as of yesterday, things are kind of flattening out. Hopefully that will continue. Interesting to back up what one of the previous speakers mentioned. One of our ERs right now is down 40%, which you have to think about. We still always have emergencies, but either people are postponing when they probably should be going to the emergency room, or maybe we're just not having as many accidents because we're not driving cars or doing some things that are more reckless. Also want to make a shout out to Senator Tillis's office. We had two constituents that were on a cruise line stuck at one of the ports in Florida, and I alerted their office to that effect on Monday, and they came home yesterday. So we're very happy with that. So I want to thank Senator Tillis's office for that. And then finally, we continue to get tremendous acts of kindness. All of our first responders are being well fed and well supported, in addition to our hospital workers. And we just really appreciate that support that's coming from the community. And I continuously am amazed that our restaurants are stepping up at a time when they are suffering more than most businesses to continue to help and support our first responders, hospital workers. And that's all I have, John.
Thank you, Mayor. We appreciate the update. Moving to the town of Davidson, Town Commissioner Matthew Fort. Commissioner, the microphone's yours. Commissioner Ford, are you on with us today? Final call, Commissioner Ford. Make sure you're not on mute. Okay, he had accepted the invite, so perhaps he got tied up, so we will move on. CMS District 1 board member Rhonda Cheek, she sent me a text, said last minute she couldn't join, but they do have a virtual meeting tonight, and she encouraged everyone to join. So CMS will have a meeting tonight, and they encourage you to join. So now, just want to make sure, Matthew Ford, are you on the phone? Okay, so now we're here to Chief Executive Officer of the Lake Norman Chamber of Commerce, Mr. Bill Russell. Bill, if you're on, the mic's yours, sir.
Thank you very much, John. John, we just wrapped a fantastic meeting of 12 area nonprofits from the Ada Jenkins Center and Angels and Sparrows all the way to the United Way, 12 different nonprofits who spoke about what they're doing and what are some of their greatest needs. That was a Zoom broadcast that we had, and we're going to be posting that on our website, our social media, and getting it out there. That's probably actually going to be pushed out tomorrow, because yesterday we had a fantastic program. Dale Gilmore, who is our business growth chair, walked through the CARES Act and PPP and how that's affecting our area businesses, how they can go in and request these loans. And that information is hopefully going to be posted today. So we'll post the CARES Act today. We'll post the Lake Norman regional nonprofits tomorrow. Also tomorrow taking place is a fantastic program. John Maxwell is an author, wrote a lot of books on leadership, and we have Dan Houston, who is one of our chamber members, is going to be doing a program. It's going to be a 4-part mastermind program, Leading Through Crisis, and that takes place from 12 o'clock to 1 o'clock tomorrow. There's still opportunity to request a Zoom reservation. You can go to our website at lakenormanchamber.org, lakenormanchamber.org. That's where that program and all of these programs I just mentioned will be placed. And again, we want to, as John Aneralla was just talking about, we want to thank those people who are continuing going out there and supporting our restaurants. A lot of our restaurants are still open and doing some great business, serving takeout and delivery. You can go to our website at lakenormanchamber.org, see some of the restaurants who are still open for business. And we encourage you to support these businesses and thank everybody for what they're doing. Again, as everyone has said on this call, we're going to get through this every day that we wake up. We're one day closer to the end of the pandemic. So thank you, John, for what you're doing, and thank everybody for all their support.
You bet. Thank you so much, Bill. Here's the Huntersville Regional Chamber. So if you need anything about them, let me know. I did get a email from Commissioner Matthew Fort a few minutes ago, and he said they got pulled into another meeting. So that explains why he was not on the call. So our next call is going to be Friday, although it will be Good Friday, so I'm not going to have any panelists on so they can try to enjoy a day off. Although I'll probably still do a short briefing. So I will have one Friday, April 10th, but again, there'll be no guest panelists, and we'll pick up our panelists on Monday. Just remember, we are stronger together. If you have any questions, lots of emails have been sent to us with your comments. We welcome those, lkntogether@gmail.com. And we hope you take care of yourself and take care of each other. Please stay safe and healthy. Thank you for listening. This does conclude today's call.